Today is the day of year 2, week 1, Mavenclad, taking it for multiple sclerosis. I am not a doctor. I'm just a patient. It's just showing you my journey with taking the medication. So talk to your healthcare professional if you have any questions or anything you need to get answered, or if you're going to go on a medication, a disease-modifying therapy or a disease-modifying drug, whatever your healthcare provider asks you to get on, or you discuss with them of a medication that you want to take. This is Mavenclad. It's my third medication. I did Copaxone, which was injections, started out daily, and then went to every other day. That did nothing for me, but I had it for a few years, and my lesions in the brain and spine grew and multiplied still. So the next neurologist changed me to Ocrevus, and that is a infusion bag where you go in, you sit at the hospital for about 8 hours, hook you up to the bag, big bag of clear liquid. You know, if it's water or actual medication sometimes. They pre-inject you with can't remember the exact concoction we had, but you get a little steroid, a little like baclofen or something like that for sleepiness, itchiness, or actually not baclofen, something for itchiness that starts with a B. It's not coming to me right now. But you take that little concoction, then you take the IV bag, you sit in a room for about 8 hours. The nurse comes in every half hour or so, turns up the drip value on your bag to increase how fast it's putting the medication into your system. And then you hopefully just have a good day and all your numbers are right, and the nurse lets you leave the hospital. Sometimes if your blood pressure and stuff is still a little high after the infusion, they'll make you sit for a little while longer. I usually get there before the hospital really opens in the morning, and I end up leaving after it's dark in the hallways and stuff like that. So it seems like the hospital is closing before I get there and after I leave. But I did audio podcast about last year's excursion with Mavenclad. This is, like I said, year 2, week 1. You have to take 5 days. Well, it depends on the person and the size of the person. Um, Apparently, if you're up to 200, the mid 200s, if you go above that, then you have to take 2 pills a day for 5 days. But it can be a pill a day. It could be 2 pills for the first day or two, and then 1 pill the last 3. Or you could, I think some people can end up only taking pills for 4 days or something. I don't know. I'm not a doctor. Just telling you my journey. So, research all you want. Even God sends out this little booklet ahead of time to get you used to everything. See what the medication's all about and get you all amped up and worried about all the side effects and all that stuff. A lot of people get nervous over these things. Year 1, the 2 to 4, I think it was 2 to 3 weeks. Well, it was like a week and a half per medication where I felt nauseous, pukey, felt like I was going to throw up every day. I did not know that was going to happen, so I didn't get on an anti-nausea medication before and during and after taking the medication until this year. I got the nausea medication ahead of time, which I do not have the bottle here right now, but you can there's a variety of different nausea medications your pharmacy can get you put on if you have issues with getting vomity and nauseous from taking the medication. But year one was rough for about a week and a half. Each week that I took the pills, like I said, you take 5 days. I have to take 2 pills for 5 days for the first week, and then I don't take anything for the next 3 weeks. And then my next round date starts around September 4th. So anytime after September 4th, I can start year 2, week 5, which is your second week of medication. And then you're done for the whole year. You don't have to take any more medication or any more of that medication for the rest of the year. So you hope your body's doing all right by the time you get to week 5 and you can finish the damn thing off, get through it, and then suffer out the rest of the year. Your body's wiped out of its T cells, I believe it is, and some B cells, and uh, that will affect how you feel, how you're going through, how you recover, because you want your new cells to come back and not attack your body like our old cells did. I always felt that Mavenclad, when I researched it years before I started it, I wanted to get on it like 3 years before I did, but my other neurologist didn't want to change my medication, didn't want to listen to me, and then I got into all the MS sites and learned a bunch of stuff, and I learned that I'm the boss, and the doctor's supposed to listen to me, and if I want to change my medication, he or she should work with me and change that medication, because I know how my body feels, and if I'm sick all the time, I don't want to be on that medication. But let's look at this. What is Mavenclad? Mavenclad is a prescription medicine used to treat relapsing forms of multiple sclerosis. I do not have a relapsing form of multiple sclerosis. I am in the advanced level of secondary progressive multiple sclerosis. I am in the progressive stage and not the relapsing stage. I can have relapses with my progressive stage. I'm more advanced. Uh, it is to include relapsing remitting disease and active secondary progressive disease, which is in adults. Because of its safety profile, Mavenclad is generally used in people who have tried another MS medication that they could not tolerate or that has not worked well enough. Mavenclad is not recommended for people with a clinically isolated syndrome, that's pre relapsing remitting multiple sclerosis. It is not known if Mavenclad is safe and effective in children under 18 years of age, and is therefore not recommended. Mavenclad may cause serious side effects. Treatment with Mavenclad may increase your risk of developing cancer. You should follow healthcare provider instructions about screening for cancer because of the risk of birth defects. Do not take Mavenclad if you are pregnant or of childbearing potential and not using effective birth control. Uh, I was told if you get someone pregnant while you're on this medication, you have to get the pregnant person to the hospital. They have to watch the fetus and do all kinds of things. I'm sure it'll talk about it right here. I don't know why I'm talking about things that I heard about and knew when I can just read it out of the book. May cause side effects, including, we talked, the malignancies, the risk of cancer and stuff. Cause birth defects. Females must not be pregnant when they start treatment with Mavenclad or become pregnant during the Mavenclad dosing and within 6 months after the last dose of each yearly treatment. I would just say don't get pregnant for about 3 years. Just, why take the chance of having birth defects in your child because of some nasty medication we gotta take? But stop treatment with Mavenclad and contact your healthcare provider right away if you become pregnant during treatment with Mavenclad. If I become pregnant, then there's something even worse wrong, so I'm not too worried about that. This talks about clinical trial results. We don't really need to learn about that. Uh, just a short dose. Just talking about the oral dosing, which I already went over. MS Lifelines is my nurse company that checks up on you. They're great with like we had a morning meeting this morning just to go over everything. We're gonna have another meeting before I start the second week at week 5. They keep up with you. They make sure your blood tests are sent in, check your numbers from your blood test. They're great with setting up the nausea medication, everything like that. They delivered the Mavenclad to me. Well, I don't know if I can't remember exactly where. I think it was MS Lifeline sent to me. But my driver's like, "Well, I'm here." And I'm like, "Well, no, you're not. You're not in my driveway." So like, I'm at Ben Franklin. That's what it says on the thing, and I get to the thing, and it's got my address. It does not say Ben Franklin, but I drove down to him and picked up my medication. It wasn't a problem. I was running errands that day, so it was just a quick little stop at a few, like a half a mile from the house. All right, we talked about all that. They'd like to repeat all the side effects and stuff. Uh, do not take Mavenclad if you had cancer already or pregnant. Breastfeeding. You are a human immunodeficiency virus positive, HIV positive, have active infections including tuberculosis, hepatitis B or C, or are allergic to cladribine. Before you take Mavenclad, tell your healthcare provider about all your medical conditions, including if you think you have an infection, because apparently if you have a current infection, it can cause other issues also, or if you have taken, take, or plan to take medicines that affect your immune system or blood cells or other treatments for MS. You definitely don't want to be on more than one DMD at a time. Take a little sip of water here. You can say it. Scratchy throat. But yeah, as far as I know, unless there's something that weird that's going on, it's not good to take 2 DMTs or more than one at a time. So listen to your doctor and talk to him about whatever questions you have and just see that way. Choose one, try that, see how it works for your body, and go from there. So Mavenclad is given in 2 yearly treatment courses. I don't know anybody that's taken it longer. I've heard rumors about someone that was on it for 3 years. I don't want to be on it after this year. I just was going to do the 2 years to see if it would do anything like a stem cell treatment. That's how I treat it, since it wipes out TMB cells and our new ones hopefully don't attack our body. And it takes like a long time for them to grow back. So takes a while before you can find out if it does anything. Last year, my gait issues came back really bad about 6 months after the medications, and a bunch of other issues came back. So I knew that the new cells that were building up in my body were also attacking me. They weren't good, happy cells like you should not receive live attenuated vaccines within 4 to 6 weeks of preceding treatment with Mavenclad. Or if you, right. Oh yeah, you're supposed to talk with your healthcare provider about that. And if you have heart failure, if you've had cancer, liver, kidney problems, and all that, breastfeeding. Each yearly treatment course consists of 2 treatment weeks, also called cycles, that will be about a month apart. Take Mavenclad with water and swallow whole without chewing. Mavenclad can be taken with or without food. Swallow the Mavenclad right away after opening the blister pack. Your hands must be dry when handling the Mavenclad and washed well with water afterwards. Limit the contact with your skin, avoiding touching your nose, eyes, and other parts of the body. If you get Mavenclad on your skin or on any surface, wash it right away with water. Take Mavenclad at least 3 hours apart from other medications taken by mouth during the 4 to 5 day Mavenclad treatment week. I have to take medications 4 times a day. So what I arranged for myself, I'm doing Monday through Friday with the Mavenclad. 8 a.m. I take my morning pills. 11 a.m. I take my Mavenclad. 2 p.m. I take my afternoon pills. 7 p.m. my evening pills. And bedtime around midnight or so, my bedtime pills. Sorry, I'm going to be drinking a lot of water because I have to anyways. You want as much water in your system as possible during this week. It makes it less problemsome, and water is good for you. So accept it, take it, live with it, enjoy it. It's one of the best things in the world for us. But the nurse did remind me, drink lots of water during this because it just helps with a lot of the issues. So. All right, so what else we got here? If you miss a dose, take it as soon as you remember on the same day. If the whole day passes before you remember, take your missed dose the next day. Not take 2 doses at the same time. Instead, you will extend the number of days in your treatment week. Mavenclad can cause serious side effects. If you have any of these symptoms listed below, call your healthcare provider right away. That's low blood cell count, which you will have blood tests done. I think I get them done pretty much every 3 months. 3 months after, 3 months following to see if they're recovering, if the cells are coming back. 9 months to get ready for the next year's Mavenclad and hope the numbers are rebounding, and then later if need be. Serious infections such as tuberculosis, hepatitis B or C, and shingles, herpes zoster. Fatal cases of tuberculosis and hepatitis have happened with cladribine during clinical studies. Tell your healthcare provider right away if you get any of the symptoms of the following infection-related problems, or if any of the symptoms get worse, including fever, aching, painful muscles, headache, feeling of being generally unwell, loss of appetite, burning, tingling, numbness or itching of the skin in the affected area, skin blotches, blistered rash, or severe pain, which is all side effects that can hit you and little things that can happen. I've dealt with a few of them last year as I was going through this. And then we have progressive multifocal leukoencephalopathy, PML. PML is a rare brain infection that usually leads to death or severe disability. Although PML has not been seen in MS patients taking Mavenclad, it may happen in people with weakened immune systems. I've tested and say positive strong or whatever for PML and had to watch it, I believe, with Ocrevus too. We had to watch it with that too, but at least there you're in the hospital, so if all of a sudden you have brain trauma, you at least got nurses and doctors around you. This one you're taking at home, so You better get to the hospital if you can. I don't know. Don't know how long it takes for the PML to cause major brain issues if you do have it happen to you, but just gotta keep an eye on things. Liver problems. You take blood tests before and after and all that to check your liver numbers and all that stuff. Uh, Symptoms of liver problems may include nausea, vomiting, stomach pain, tiredness, loss of appetite, dark urine, or your skin or the whites of your eyes can turn yellow, which I think that's jaundice. Uh, Allergic reactions like hypersensitivities. You should stop treatment and seek immediate medical attention if any signs or symptoms of allergic reaction occur. Symptoms of an allergic reaction may include skin rash, swelling or itching of the face, lips, tongue, or throat, or trouble breathing. Heart failure. Mavenclad may cause heart failure, which means your heart may not pump as well as it should. So call your healthcare provider or go to the closest emergency room for medical help right away if you have any signs or symptoms such as shortness of breath, a fast or irregular heartbeat, or unusual swelling in your body. The most common side effects include upper respiratory infection, headache, and low white blood cell counts. I know a lot of people get headaches, and I never had to deal with it the first year, so hopefully I don't deal with it this year. I'd rather have a headache than have PML or liver damage or heart failure or something like that. That's the basis of the book, all the information to get us started. But I'm going to get ready to take my med. I'm going to start out by doing a blood pressure check. Keep track of this. Well, I don't have to, but I do. So the nurses can get numbers and don't have to go to a doctor's office to have it done. These cuffs are awesome. You can test it on your days that you go to your doctor. Do your cuff at home before you go to your appointment, and then just see if it matches up with the numbers when you get to the doctor's office when they do their blood pressure cuff. The numbers will be way wonky and it doesn't want to give me good reading. Trying not to move too much or trying to let the cuff not think that my voice is 122 over 58. It's almost perfect. Where you want to be is 120s over 60s, I believe, is the standard. At least it used to be. I think now it's like 130 over 70 or something like that. Don't take my word for it. Not a healthcare professional. All right, so here we go. Let's do this. Got our water. Pre-sip. Probably take another pre-sip just to get that throat canal nice and watered down so you don't have to don't taste it or feel it sticking to the side of your esophagus or something. We get these little plastic cups at restaurants all the time when you go get takeout food. Keep a couple handy. They're great little things. But that's what I'm using for my medication cup so I don't have to touch the medication at all. I just pop it in there and get rid and toss it down my throat and done for the day. Here's the box that your stuff comes in. Just a nice big box for 5 days worth of pills. You open it up. Got this little thing on the inside. You just take out, get rid of that, toss it in your recyclables. Medication comes in 5 little square packs. Each pack has 1 day's worth of medication. Then you get rid of it. There's all your information on top. If you need to reconfigure all that. But pull one out. You have these. Oh, you have a little piece of tape on it. So you take this little piece of tape off it. Throw that away. Open up the flap. Inside, you got a little blister pack. They have 2 little tabs here that you have to push. One there, one there. You push those in. At the same time, you pull it out. Here's your Mavenclad medication. Pop that out of there. Put that back together. Put it over there to be recycled. Now we got the blister pack. 2 little silver things. Each one has a pill in it. So you take it. I want to get this set up a little bit higher for you. So you can at least see me drop it in. Okay, there you see my cup. Kind of see my cup. Let's see. There you go. That's better. That'll work. All right, there's the cup. Blister pack. Never going to touch it with my finger. Just, popped one in. Second one's in. I don't want to give it long. Just going right down quick with it. Good shit, Maynard. Like the get a few good swigs because I want that shit to go right in my stomach. I don't want it sitting stuck to the side of my mouth. One of my biggest worries because you would think if it did, or not my side of my mouth, to the side of my intestine, because then you gotta worry about it sticking there, and with all the cancer problems and properties and stuff like that, you gotta worry that all of a sudden there you got stomach cancer forming or something. Who knows? I don't know. I'm not a doctor. I keep telling you that. Nobody's listening. I know I sound really intelligent, but I'm not a doctor. It's always scary taking a new medication or taking any medication that has these type of properties. But the reason I took Mavenclad, well, my doctor prescribed it, and because I always felt I wanted stem cell treatment, but could never get it without leaving the country and going and spending thousands of dollars in a strange foreign land and letting doctors do things to you. And it takes like a month, like 3 weeks to a month or something, if you get the right stem cell stuff done. You go through chemotherapy and to kill all certain cells and all that in your body, whereas we're taking a pill to kill, basically a chemo style pill that's gonna wipe out our TMD cells. And it just, I figured that's the closest chance I have to rebuilding new cells and maybe having what I could have if I could get stem cell research done. But now, after all the stem cell uh, stuff I've heard about and been researching, stem cells aren't really repairing stuff. It's going to be a lot like I said, I'm not a doctor. Just me from hearing people talk about stuff, but LASIK eye surgery. A lot of people after about 10 years start going back to the way they were and having problems again. Stem cell therapy, I believe, is the same concept. You're going to have it, and after about 10 years, we're going to start hearing finally people saying, okay, well, I felt better, I had better gait, I had better cognitive cognitive things got better. Yet all of a sudden now it's coming back. Now I'm in pain. I got my fatigue back. I got my cognitive issues back, and slowly things are coming back. It's just, if the surgery is not going to fix anything on the permanent, I don't know. It's nice getting the relief, but it also sucks when you get a little relief from pain and then that pain comes back. Because, I don't know, I'm the type of person that I can accept pain. I've had it most of my life. I'm You kind of get used to certain pains, accept them, and when they go away for a little bit, like when you're in a relapsing remitting stage of multiple sclerosis, you'll have some issues, and all of a sudden they'll go away to an extent or go away fully, and then all of a sudden come back a month or 2 or 3 or 4 or 5 or 6 months later. And it's like, oh, I wish I would have just had the pain the whole time because my body was accepting it and it was becoming the norm. I was more looking for a new pain than try and get rid of the pain. But it's just, when it comes back, it's just all the way back to the beginning nastiness again and having to suffer issues until your body's just accepts it and says, screw it, this is my life again. I gotta deal with this pain all the time, or fatigue, or cognitive, whatever, any of your problems. But yeah. So that was day one. I'm gonna do a video maybe every day while I take my medication. We'll get results on how the days are going, what kind of issues I dealt with the day before, and all that. But today I'm just going to quickly go do a couple errand runs, get my stuff done, and then hopefully I won't have to worry about running too much this week. And I can just sit there and ride it out and see how what the medication does, and hopefully this time it does a better job than last time, but I don't have no high hopes. To me, I just feel like I'm another guppy. It's not a guppy that I'm thinking. Test subject, lab rat. So I'm basically taking a medication that can cause all kinds of ways to kill me and destroy me and cause all kinds of issues with my body. Or it could ease up some of my symptoms. I'm still going to have everything anyways, and I'm just never going to get rid of it because there is no cure for MS. I don't care who you are or what you are. It's proven there is no freaking cure, so quit telling us that there is. But yeah, we'll just see what happens with it and keep you informed. So someone that's getting ready to start brand new, start their first year, their year one, week one, it's a word that will be in your vocabulary. The year, the month, the week, thing that a lot of people like describing their Mavenclad journey with. So I only follow it during the pill taking process. I don't keep up with it after that. A lot of people will just type in, "Oh, I'm year one, week 17, or year one, month 3, week 2, or whatever." No, I just use those numbers just during the pill taking process, and then the rest of it's just life, as far as I'm concerned. Daily living life. Daily living with a chronic condition. So take care of yourself, take care of everybody else, rate, review, tell a friend, give me a thumbs up, subscribe if you can. Check out Crimson Colored Comic Club, Under the Call of MS in all audio and video formats on different platforms. And we will keep you informed of how this fun, wonderful journey goes. We'll be back again maybe tomorrow. So, and I am recording this on August 8th. It probably won't be on YouTube till a week later, but I'll try and get it out as soon as possible. So, take care. Bye.